Welcome, sophomores, NCM 107A, care of the mother, child, and adolescents. Well, client, now we are in the fetal development and also the fetal circulation to the point that we're going to have now your fetus. Okay, so the development of it until we go to the pregnancy. So please bear with me in discussion, and I hope everyone who's listening, if got questions, let me know during our synchronous or face-to-face classes. The intrauterine development of this will be more on the discussion that we have. I'm trying to link with the 2023, okay, board exam, because they said that there would be a lot, especially the COVID-19. Even it is post-pandemic, we're still going to have in the intrauterine development part of the viruses that could affect your growing fetus. So learning goals set and objective, normal fetal development from ovulation to birth. Then we have fetal circulation, okay, and then we have fetal growth and assessment and teratogens, the one with the potential effects on the development of our fetus. We have a lot of vocabulary that you have to particularly remember: the blastocyst, conception, ductus arteriosus, embryo, fertilization, fetus, foramen ovale, human chorionic gonadotropin, and you have your HCG, implantation, the lecithin sphingomyelin ratio or LS ratio, gestational age, the vernix caseosa, zygote, placenta. Even some quickening will be mentioned, which is more on the pregnancy, surfactant of the lungs, teratogens in umbilical cord. I will discuss that each one. So here, I have to mention to you the review that we have before we go to the main point of the fetal development or fetal circulation. First, remember the coitus or the intercourse, that there would be a perfect combination, that we're able to have the sperm travel to the ampulla, okay, of the fallopian tube. Then what happened? There is the capacitation. The sperm approach the egg, and the sperm release a hyaluronidase. Don't forget that substance that dissolve the protective layer of the egg, allowing the penetration of the sperm for fertilization. The joining of the sperm and egg happened. Then now the product of fertilization is the zygote. The zygote travel the uterus approximately 3 days. Zygote duplicate to 1 to 8 cells, and then the morula, the mulberry or the one with uh, fibers or a lot of 16 to 50 cells, that is the morula. Then you will have the blastocyst after the morula. It is a fluid-filled cell mass during the time of travel. On the secretory phase of menstruation, it is attached to your endometrial lining. So mention that after the blastocyst, there are two important factors during the time. The trophoblast is the cell that the blastocyst outer ring then eventually develop to your placenta and membrane. Don't forget your trophoblast na emerge, lumabas, develop ang placenta and the membranes. And the erythroblast, the embryoblast, inner cells mass that will develop to embryo, the trophoblast and the embryoblast. From that point of the blastocyst, which the trophoblast and the embryoblast created, we have the implantation. This was all discussed in the other modules, video discussion, the contact between the growing fertilized cell and the uterine lining. Then the most highest important is the apposition. It is when the fertilized egg brushes the endometrial lining in our implantation. Then that will happen. The embryo or the fertilized egg is now implanted. That is the review of the coitus to implantation. So now in this diagram, you would see the fertilization. It is the begin with the 46 pair of chromosomes splits off to 23, then combined for a unique new of 46 pair. Now we call the uterus, as I mentioned the other module, that the decidua or the uterus, which is now called the decidua, from the time it is implanted, yung ating fertilized egg, result from the preservation and further thickening. So once the uterus have been thickened for endometrial lining, it is called decidua. The corpus luteum by the HCG, the human chorionic gonadotropin, cause the elevation of the protein level that cause the development of the decidua. So, it is the corpus luteum na nagsisecrete ng HCG para dumiretso yung ating decidua for a good environment sa ating embryo. So this is the cycle that we have from zygote to conceptus. Don't forget this. The human development from the zygote, there is the blastomere that I have mentioned a while ago, the morula, the one with the duplication, then the blastocyst, then embryo, the fetus, and conception. These are the formulation of our human development. So don't forget yung cycle, zygote, blastomere, the morula, how you will change to blastocyst, then mag-emerge na yung placenta and the embryo. And then we have the fetus and the conceptus. The stages and time frame: ovum, the zygote is 3 to 4 days and 16 to 50 cell. Then we've got your morula, 3 to 4 days. We have the blastocyst, the embryo, and the fetus. We have 7 to 8 days for fertilization to implantation. As mentioned of the trophoblast, it is the outer layer of the blastocyst where the large portion of placenta and its membrane develop. So mentioned here that we have the, nice to know na lang yung mga single cell, don't forget the trophoblast. Okay, of all, it is the trophoblast. The trophoblast proliferates, dumami, and differs into two cell layers as approximately at the 6th day of the fertilization. The primary germ layer, we have the cephalocaudal growth and development, stem cell, 4 days of zygote, your stem cell used for the reproductive cloning, multipotent after a few more days, specific parts develop. It is more on the primary germ layer, how it is being developed. This is the most sensitive part, okay? Because we could have a lot of um, deformities, okay, and these are the time that it is now the germ layer or the embryo will be developed. The fetal development, ovum or pre-embryonic, lasts from the conception until to the 14th day. This period covers cellular replication, the blastocyst formation, initial development of the embryonic membranes, and establishment of the germ layer. So, don't forget the ovum and pre-embryo. Diyan tayo nag-base. Kaya, ang OB, chine-check if didiretso yung pregnancy because of this fetal development. The primary germ layer, we have different, uh, kumbaga yung pinaka-parts. The first one is the ectoderm. The upper layer of the embryonic disc form the epidermis, the glands, which is the anterior pituitary, cutaneous, and mammary, the nails, the hair, the central nervous system, the PNS, the lens of the eyes, the tooth enamel, and the floor cavity of amniotic fluid. That is the ectoderm. The first, the upper layer of the embryonic disc. Next, we have the mesoderm. The mesoderm from the fetal development is the middle layer, forms the bones, the teeth, the connective tissue, the central vascular system or the cardiovascular system, the spleen, the muscles, the skeletal, the smooth, and the cardiac, and the urogenital system. The last layer of this is your endoderm, the lower layer which rise the epithelium lining of the respiratory and digestive tract. The glandular cells of associated organs including the oropharynx, the liver, the pancreas, urethra, bladder, and vagina also form the roof of the yolk sac. Those are the layers that you are particular of, and then para madiretso ang ating fetal development. So with the fetal membranes, you have your chorion and amnion. Chorion develops from the trophoblast and contains the chorionic villi on its surface. So remember, importante ang chorion kasi andun ang chorionic villi. This becomes the covering the fetal side of the placenta, contains major umbilical cord vessels. The amnion is the inner cells membrane developed from the interior cells of the blastocyst. The cavity that develops between the inner cell mass and the outer cell of the layer of the cell is called the amniotic fluid. So you could see here the amniotic glands, the amnions, the inner membrane ruptured or torn, the chorions, the outer membrane. Please take note of that. As it grows larger, the amnion forms the opposite side of the developing blastocyst. The developing embryo drones the amnion around itself, forming a filled sac as mentioned dun sa ating review kanina. The amnions becomes the covering of the umbilical cord and the chorion of the fetal surface of the placenta. We have the trimester. The first trimester is the first 1 to 13 weeks. And the second trimester will lead to 14 to 26 weeks. And the third trimester is the weeks of 27 to 42 weeks, meaning for actually 38 weeks po pwede ng mga anak. Okay? Until to the 42 weeks. So we have here, you can see the drawing that how your fetal development in this trimester. This will be more discussed during the pregnancy. So this is discussed earlier, the amnion and the chorion, right? The decidua basilaris developing the placenta, yolk sac, amniotic cavity. The amnion, as mentioned, the amnion produce the fetal surface of the placenta, while the chorion is the chorionic villi, and the center core of the produce the placental hormones such as your HCG, HPL, estrogen, and progesterone. Tandaan nyo sa chorion galing yan. So day 1, from the time after the implantation, the first cell of the human being is called zygote. It is formed the sperm, fertilized in the egg. The egg cell shows here the nuclei of the sperm, and the egg appears as a two yellow-brown irregular shapes. These were the two nuclei infused during fertilization. Day 3, the zygote begins a journey down to the fallopian tube, to the ampulla. Okay? From the ampulla nag-meet now 36 hours after fertilization, cell divisions begin in the fallopian tube. Dapat nagmo-move to occurs in twice a day. In the 3 to 4 days, the cluster of dividing cells completes a 10 centimeter into the journey to your fallopian tube para ma-reach ang uterus, soon to be the decidua. Day 6, after the 5th day after fertilization, the cluster of about hundreds of cells floating in the uterus, soon to take a fluid-filled ball called the blastocyst. After 1 or 2 days in the uterus, the blastocyst burrows into the uterine lining. Ibig sabihin, gumagawa ng way which grows para makapasok, which grows to the blastocyst and provides its nutrients. In the first trimester, the most significant, or the first trimester, the 1 month, at the end of the 4 weeks, the baby is 1/4 inch in length. There is the heart, there is the digestive system, the backbone, and the spinal cord begin to form. The placenta, sometimes called the afterbirth, begins to develop. So first month pa lang, nagde-develop na yung placenta. The single fertilized egg is now 10,000 times larger than the size of conception. Form the primitive organs, yes, the most delicate, because we could have a lot of teratogens that could harm the growing embryo. The head can be distinguished. The 4 weeks embryo measures about 5 millimeters from the crown to the rump. That is the picture, parang isda, right? But yet meron ng distinguished na yung ating heart. Okay? 6 weeks begin the formation of the lungs, further development of the brain, the arms, the legs, and lengthened with the foot and the areas distinguishable. Hands and feet have digits but they are not still naka-web pa rin yung mga uh, fingertips or mga finger ng ating growing embryo. 2 months, 1 and 1/8 inches in long, okay, about 30 millimeters from crown to rump. Now, we could have at the 8 weeks, mas malakas na yung heart. Heart is functioning, heartbeat could be distinguished. The eyes, the nose, the lips, the tongue, ears, and teeth, the teeth are forming. The penis begins to appear in boys at the 2 months. Kaya lang hindi pa ganun ka-visible, though it appears. Baby is moving, although the mother cannot yet feel the movement because look at 30 millimeters pa lang. The embryo passes in the fetal stage of development. The fetus show here the floats in the watery amniotic fluid which contain bitransparent of tough amniotic membrane. The amniotic fluids acts as the shock absorber, preventing damages to the fetus, developing fetus. That is your second month or 8 weeks. At the third month, the baby is now, or the fetus is now 3 inches long and weigh half to 1 ounce. The fetus develop from the nails develop, the earlobes are being formed, arms, hands, finger, legs, feet, and toes are fully formed. Eyes are fully developed. So you would say that it is striving to survive. Baby has developed most of the organs and the tissues. The heart rate can now be heard at the 10th week. So board question to, common board question. At the 10th week, we can now use the Doppler to listen to the heartbeat of the fetus. At the fourth month, now the fetus is 6 to 7 inches long and it weighs 6 to 7 ounces. Now it is developed reflexes such as sucking and swallowing. So pag in ultrasound, makikita nagsaswallow or nakatam sucking. The tooth buds are developing. Sweat glands are forming on palms and soles. Fingers and toes are now well defined, hindi na web-like. Now, it could be identify na yung genitalia or the sex. The skin is bright pink and transparent, covered with soft downy hair. The lanugo, soft downy hair. Ibig sabihin yung mga buhok sa katawan yon, we call it lanugo. Although recognizably human in appearance, the fetus would not be able to survive the outside of the mother's womb. The meconium or the stool of the fetus is produced in the intestinal tract. Liver and pancreas, andun lang. Okay? Kaya makikita nyo eventually pag pinanganak may mga kulay gray. Okay? Nalalabas. Iyon yung na-stuck na meconium. The liver and pancreas produce their appropriate fluid secretion. That's the fourth month. Fifth month, the baby is 8 to 10 pounds. Don't forget sa fourth month, pwede naman distinguish in gender or sex ha. Hair begins to grow on the baby's head. Soft, woolly hair, lanugo, is now all over. As I mentioned, mas marami na at the fifth month. Mother now begins the fetal movement. Internal organs are maturing. The eyeballs, eyelids, eyelashes appears. The toes of the fetus is more active with increased muscle development. The 6 months, it is 11 to 14 inches, weigh until 2 pounds. The eyelids begins to part and the eyes open sometime for short periods. So, nabukas na yung eyes. Okay, the skin is covered with protective coating called vernix caseosa. Ano yan? Yan yung malagkit and it helps for the temperature pag lumabas na yung ating fetus. Okay, pag it is a newborn, what will happen, yung vernix caseosa, hindi natin basta tinatagal kasi it protects the temperature of our infant. Pero dito, protective coating pa rin siya inside. The baby is able to do hiccups at the 6 months. The eyebrows and eyelashes are well formed. The fetus has a hand and starter reflex, nagugulat na for the footprints and fingerprints natin. Forming alveoli, nag-start pa lang ngayon yung forming ng air sacs into the lungs at the 6 months. So, how delicate pag nanganak, pag 6 months, right? Pag nag-labor and delivery, in the 24 weeks. In the 7th month, or 28 weeks, it is 14 to 16 inches, weigh until 2 pounds, the taste buds have developed, may fat layers na to, the organs are maturing, the skin is wrinkled and red. If born at this time, baby will consider sa premature and require special care. Yes, kasi nag-start pa lang yung kanyang surfactant ng lungs. Rapid increased amount of body at rhythmic breathing movements occur, but the lungs are not yet fully matured as I mentioned. Bones are fully developed but still soft. Palliable fetus begin storing iron, calcium, and phosphorus at 7 months or 28 weeks. 8 months, okay, or 32 weeks. The baby is now 18 inches long, 4 to 6 pounds. Dito, kinokontrol na natin yung weight. Baka kasi maging so large for gestational age. So the overall growth is rapid in this month. Tremendous brain growths occur at this month, at the 8 months. Most body organs have developed with exceptions of the lungs. More movement or kicks are stronger enough to visible from the outside. Kidney now mature. The skin is less wrinkled. The fingernails now extended beyond the fingertips. Kaya may mga mahahaba. So once nahawakan na yung face ng ating newborn, talagang by that 8 months pa lang, mahaba na yung mga fingernails. The ninth month, the most awaited, it is the 38 weeks and until to the 42 weeks. The baby is 19 to 20 inches long. The most desirable is 7 to 7.5 pounds. The lungs are matured, or the surfactant of the lung is 2 is to 1 in Selfingo. LS lecithin salpingomyelin. Baby is now fully developed and can now survive outside the mother's body. The skin is pink and smooth. The baby settled down lower in the abdomen in the preparation for birth and may less active. So, hindi na masyado nag-move kasi most of the time, ano na yan, form or position na intact yung head do sa ating station or yung pinaka-pelvis. Stages of development, as I mentioned, look at the first month until to the third, or the first week to the 38 weeks. You could see, as I have mentioned, from the period of dividing zygote, there would be the implantation, the amnion, the chorion, the embryonic, the blastocyst, until it's fully mature. As I have mentioned, each category, the heartbeat is being, may heartbeat niya, pero mas cleared sa 8 weeks. Amniotic fluid, now we are in the parts of the growing fetus. It is clear yellow fluid surrounding the developing fetus. Average amount is 1000 ml. Don't forget 1000 ml. But if it is less than 300 ml, it is related to fetal renal abnormalities, or what we call oligohydramnios. But if it's more than 2 liters, we call it hydramnios. Associated naman to sa gastrointestinal and other malformation. So kapag oligohydramnios, kulang, okay, yung amniotic fluid, fetal renal abnormalities. Pag if it is more than, we call it hydramnios. Sa gastrointestinal naman. Don't forget the amniotic fluid. 1000 ml is the average. Clear fluid, a yellowish fluid, okay, that helps the function, isa-isay natin. So, amniotic membrane provide support the amniotic produced by the amniotic fluid, produces precursor to, ang amniotic membrane may prostaglandin, kasi ang prostaglandin is the one who's going to irritate and do the contraction at the 38 weeks and above. It has no nerve supply, which is evident during the painless rupture of membrane. Pag meron nag-rupture na water, okay, bago mga nag-start na magkaroon ng labor, walang pain yun kasi there's no nerve supply in amniotic membrane. The amniotic fluid function protects the fetus, or it is the cushion. Ito yung cushion sa ating fetus para hindi magkaroon ng any endangered, or basically, pag kinukusyon meaning pinoprotect para hindi magkaroon ng direct na any hurt or pain yung ating fetus. Allows movement, source of oral fluid, ang amniotic fluid natin. Okay, acts as an excretion collection repository. Maintain constant body temperature. So, the amniotic fluid help also in the temperature inside. Okay? Shields against pressure or blow, as mentioned, as cushion to the mother's abdomen. So the amniotic fluid also responsible to aid the muscular development because it allowed the fetus freedom to move, protect umbilical cord from pressure, protecting fetal oxygenation. That is the amniotic fluid. Umbilical cord, so one of the most important. It is connecting link between the fetus and placenta. It transports oxygen and nutrients to the placenta and returns the waste products from fetus to placenta. Mamaya sa fetal circulation, makikita nyo na lahat si umbilical cord, placenta, the mother, okay, nagsashanting lang, nagsusupply lang ng parang nagsusupply lang ng blood, pero all is going on with the placenta and the umbilical cord. Remember the taob, two arteries and one vein. It is supported by the Wharton's jelly. Remember the word Wharton's jelly? It is a mucoid material to prevent kinking and para hindi magbuhol yung ating umbilical cord. There is no pain receptor. So tandaan nyo, huwag kayong magugulat kapag kinat yung umbilical cord. May pain ba yan? No, because there is no pain receptor. It is composed of smooth muscle which constrict upon fetal delivery, naturally clamping the blood vessels and preventing bleeding. The average length of umbilical cord or the fullness in human is 55 centimeter and it is diameter is 2 centimeter. Don't forget the 55 centimeter and the taob, the two arteries and one vein that you have to assess in the umbilical cord. There are larger veins or arteries joined together which serve as circulatory communication with the maternal blood. As mentioned, we have the 53 inch centimeter, but the average is 55 centimeter. Okay, 2 centimeter in thickness. Contains the vein, as mentioned, from the placental villi to the fetus to carry. So sabi yung one vein, blood from the placental villi to the fetus. Two arteries carry the blood from the fetus back to the placenta. Ulitin natin na yung taob natin, yung one vein carry the blood from galing sa placenta papunta isusupply sa fetus. Pabalik naman sa fetus to the placenta are the arteries. The functions of umbilical cord: transport oxygen, transport nutrients to the fetus and placenta, return waste products from fetus to placenta. Ano to? Siya yung tube. That's the umbilical cord functions. Now we go to the placenta. You will see this in the delivery room. We have the types of placenta, the decidua basalis, okay, as mentioned. This is more on the one that supplement the schematic drawing of placenta, supplies oxygen and nutrition to the embryo and removes also the waste products. Okay. The placenta arises from the trophoblast tissue, as mentioned, serve as fetal lungs, the kidney, the gastrointestinal tract, and also separate the endocrine organs throughout the pregnancy. It is 15 to 20 centimeter in diameter and 2 to 3 centimeter depth at term. Structure that involve mediating between the maternal and fetal circulation and producing essential hormone during pregnancy. So the placenta filters allow smaller particles through the hole and holds back the larger molecules. So we have the diffusion, facilitate transfer of glucose, amino acid, and minerals, and diffusion, the gases, the water, the electrolytes, and the pinocytosis, the movement of minute particles are all being done by the placenta. What are the function? Source of oxygen, source of nutrients, source of important hormone producing system. Isa ko yung apat yung mga pinuproduce sa placenta ng mga hormones. Act as a barrier against microorganisms and some drugs. Mother transmit the immunoglobulin G. Don't forget ang binibigay ng placenta transmission is the IgG to fetus providing limited passive immunity. Leakage caused by membrane defect may allow maternal and fetal blood mixing, which is very fatal tong leakage na to. So remember the placenta, the IgG or the immunoglobulin G. What are the produce protein hormones as mentioned? It is the human chorionic gonadotropin or HCG. 8 to 10 days past conception is the basis for pregnancy test. Diba isa yun sa mga inano nyo, HCG, tinek nyo dun sa pregnancy test na return demonstration. Progesterone, estrogen, human placental lactogen are all being released by the placenta. First is the human chorionic gonadotropin, the first hormone that produced the placenta present circulation during the first 100 days of pregnancy. So, yun yung dinidetect natin kung talagang nag-positive sa pregnancy test. Ensures the corpus luteum, tandaan po natin to, ensures the corpus luteum of ovary continue to produce the progesterone and the estrogen also exert an effect on the male fetal testes to begin testosterone production. So that's all for human chorionic gonadotropin or HCG. The next hormone produced by placenta is the estrogen or the primarily estradiol. It is the mother's mammary gland developed in the preparation of lactation. This estradiol helps the mammary gland develop in the preparation of lactation, stimulate the uterus to grow to accommodate the developing fetus. That is the main function of your estrogen. For the mammary gland and the growth of the uterus to grow, accommodating para magkaroon ng good environment ang ating fetus. That's your estrogen. Now we have the progesterone, also referred as the hormone of mothers. Remember, as mentioned in the menstruation, your hormones of progesterone maintain the endometrial lining of the uterus during pregnancy, induction of the uterine musculature during the pregnancy, which prevent premature labor. The next one we have is the human placental lactogen. It helps prepare the body for breastfeeding. It also regulates metabolism and insulin sensitivity to make sure the fetus gets the enough nutrients. It increases maternal insulin resistance and reduces maternal glucose utilization, elevating the maternal blood glucose level. Kaya napaka-prone ng gestational diabetes. Okay? Those are the hormones produced by the placenta. The viability. The age of viability, survive. Okay, survival. Pag sinabi mong uh, natapos ay sa yung organogenesis natin, okay, at the age of 24 weeks, okay, we could sure that it is now at the second trimester na to, magkakaroon na tayo ng sasabing, oh, yung fetus mo, alaga ng support na rather than ma-abort. Okay? So, survival depends on the maturity of the fetal central nervous system and the maturity of the lungs. Remember, the age of viability is 24 weeks. Respiratory system, the terminal sac between the 24 weeks to the birth, doon palang nag-create yung respiratory. Growth of primitive alveoli. Pulmonary surfactants produce a switch as sweating agents that prevent alveolar walls from sticking. So, pag insufficient yung surfactant, we could have the RDS or respiratory distress syndrome. Kaya nga ini-evaluate yung maturity at the 35 weeks. Dapat may 2:1 lecithin sphingomyelin phospholipid ratio. Okay? 2:1. So, yung 30 to 32 weeks ng respiratory system, 1:2, hindi pa matured. So, there could be a respiratory distress syndrome. That is the most important that you have to do is to validate if it is LS or lecithin sphingomyelin ratio natin, may mature din lungs mo, 2:1. Cardiovascular system, the first system to function. Fetal heart rate is 120 to 160. You can hear, as mentioned a while ago, by the fetal heart rate, the 10 to 12 weeks, non-stress test and stress test could be validated with the mother para lang ma-check yung cardiovascular system. Fetal circulation. We have now the article, so dahil nasa heart na tayo, the arteries in the umbilical cord, fetal body carries the oxygenated blood. So remember, the arteries in the umbilical cord carry the deoxygenated blood, kulay blue. The vein in the cord and those in the fetal blood carries the oxygenated blood. Okay? The ductus venosus connect at the umbilical cord and inferior vena cava bypassing the portal circulation. Don't forget, yung ductus venosus nyo ang nagba-bypass. Ibig sabihin, para hindi magkaroon ng circulation ng sarili yung fetus. Still, the placenta and the mother via ductus venosus ang nagkakaroon ng good circulation at binabypass ang portal circulation. Fetal circulation, it is a fully developed human. The heart serves two main purposes. Okay, the right heart pumps the blood to the lungs for oxygenation, and the heart pumps oxygenated blood to the rest of the body. Ano to? Shunting. Pag sa shunting, bukas na lang in order to supply blood. In the embryo and the fetus, the lung do not oxygenate the blood. Okay? So, remember, the fetus embryo, hindi nagpa-function yung lungs. The fetal circulation is consequently quite different from that of the breathing adult. When the baby or the newborn takes the first breath, that's the duct closes, okay? And blood is rerouted to the lungs. At the fetal circulation, maririnig lang yung shunting or nagsusupply lang ng blood para manorish yung mga organs. So in the normal blood circulation, remember from inferior and superior vena cava magko-collect yung blood, going ito yung unoxygenated blood to the right atrium, then it will bypass or it will papasok sa tricuspid valve that will go to the right ventricle of the heart. When now in the right ventricle, we will go to the pulmonary valve which enter the pulmonary artery, then it will go to the lungs in order for the oxygenation para magkulay red na. Then the oxygenated blood going to your pulmonary vein then will go to the left atrium via mitral valve going to the left ventricle to supply the oxygenated blood, then to your aortic valve and aorta going to the systemic circulation. This is the normal blood circulation of an adult. So we're going to discuss the fetal circulation. As I mentioned, it is only going to be shunting and supplying of blood. The fetal circulatory system of human fetus often encompasses the feto-placental circulation that include the umbilical cord, the blood vessels within the placenta that carry the fetal blood. So this is the location and function. As I've mentioned, shunting lang, supplying. So the placenta attached to the uterus. Okay, the function of the placenta, the gas exchange during fetal life. Okay, pag hanggat nasa loob ng tiyan, si placenta ang gas exchange. Umbilical vein, one vein in one cord. Okay, so we have umbilical arteries, two arteries in one cord. The taob, umbilical vein carry the oxygenated blood to the fetus. While the umbilical arteries carries the away nga, di ba? Unoxygenated blood from the fetus. We go now to the three most important, the foramen ovale, the opening of the atrial septum between the right and left atrium, the function, shunts the blood from the right atrium to the left atrium. So the blood will be supplied to the brain, heart, and kidney. So siya shunt niya is i-close niya. The foramen ovale will shunt and then magkakaroon ng blood supply sa brain, sa heart, and the kidneys. Now we have the ductus venosus. It is an accessory vein connecting the umbilical vein into the fetal liver and inferior vena cava. The ductus venosus supplies the blood to the liver, bypass the fetal liver. Magsusupply lang. Bibigyan lang niya ng shunting or bibigyan niya lang ng circulated blood natin. Hindi pa rin nagpo-produce ang ating fetus. The ductus arteriosus shunts off the larger portion of the blood away from the lungs and directly to the aorta. So don't forget, your umbilical vein, one vein in one cord, umbilical arteries, two arteries in one cord, okay? The foramen ovale, the ductus venosus, and the ductus arteriosus. So here, mention the ductus venosus between the umbilical vein, okay, and your inferior vena cava. We have the foramen ovale between the right and left atrium. Ito yung mga location and ductus arteriosus between the pulmonary artery and the descending aorta. Pag sinasabing shunting, kino-close niya para hindi mag-direct, hindi magsama yung unoxygenated and oxygenated blood. The placenta facilitates the gas and nutrients exchange between the maternal and fetal blood. The blood itself does not mix at all. Placenta role. The core concept behind fetal circulation is the fetal hemoglobin has higher affinity of oxygen than does of the adult hemoglobin, which allow the diffusion of oxygen from the mother circulation system to the fetus. The circulatory system of the mother is not directly connected to the fetus, so the placenta could function as the respiratory center of the fetus as well as the site of filtration for the plasma nutrients and the waste. So, walang pakialam si yung mothers, yung heart or cardiovascular ni mother. It is all the placenta. Okay, as mentioned, you can see here the image. If it is red, it is oxygenated, and the oxygenated if it is blue, mixing proper to the fetal. So very rare yon kasi nagsashunting tayo. By the third month of development, all major blood vessels are present in the functioning. Fetus must have blood flow to the placenta. The resistance to blood flow is now high in the lungs. Exchange of gases occurs in the placenta. Oxygenated blood is carried by the umbilical vein towards the fetal heart. The ductus venosus direct part of the blood flow, the umbilical vein, away from the fetal liver for the filtration of blood by the liver is unnecessary during the fetal life. So, hindi kailangan magkaroon ng filtration sa liver. And the direct inferior vena cava. Blood from the ductus venosus enters the inferior vena cava. Increased level of oxygenated blood flows in the right atrium. In adults, the increased pressure of the right atrium causes the tricuspid valve to open. Thus, nagkakaroon ng draining sa right ventricle. However, in fetal circulation, most of the blood in the right atrium is directed to the foramen ovale, the opening between the atria. Iyon yung butas. Yan yung dapat mag-close upon birth. Kasi kung hindi, magkakaroon tayo ng heart problem. Okay? To the left atrium. So, that is your foramen ovale. You can see here the picture. Yun yung mismong position ng foramen ovale. The portion of the blood drained into the right ventricle passes the pulmonary artery. You can see the difference between the oxygenated and non-oxygenated blood. The blood enters the pulmonary arteries, carries the blood to the lungs, and also called the ductus arteriosus, connect the pulmonary artery and the descending aorta. Most of the blood will bypass the non-functioning fetal heart or fetal lung. So, yung fetal lung, nagpa-function yung heart mo, pero yung fetal lung mo, lalagyan lang siya ng blood and will distribute to different parts of the body. A small portion of the oxygenated blood that enters the fetal lungs, therefore, for fetal maturity. The umbilical arteries now carry the non-oxygenated blood away from the heart to the placenta for the oxygenation. This is the blood flow or the flow chart of fetal circulation as mentioned. The placenta will now go to the via umbilical vein. Then we will go to the liver for shunting. Then the ductus venosus will enter now the inferior vena cava. The right atrium, kita nyo, nagsashunting lang, nagsusupply lang ng blood. Going to your foramen ovale, nasa gitna to. Now we'll give the left atrium and the left ventricle to the aorta. Okay? Then, pati yung pulmonary, yung lungs, bibigyan lang din ng shunting. This is the fetal circulation. The foramen ovale allows the blood flow from the right to the left atrium bypassing the lungs. The ductus arteriosus allows the blood flow from the pulmonary artery to the aorta bypassing the fetal lungs. So as mentioned, the foramen ovale closes shortly after birth, fuses completely in 1 year. Ductus arteriosus closes after birth, becomes a ligament. Okay? In 3 months, the ductus venosus, a ligament venosum. Umbilical arteries now become the medial umbilical ligaments, and umbilical veins, the ligamentum teres. Ito na yung after birth, kung ano nangyayari sa mga natin sa typical, the one who help in shunting the organs of our fetus. First breath, now I told you there would be closed lungs expanded, pressure in the left atrium increases, the blood return to the via pulmonary vein, stimulated the closure of your foramen ovale. Dapat mag-close yun. There are times may murmur, pero within 3 months, dapat totally close ang foramen ovale. It increases the oxygen saturation, causes the ductus arteriosus to constrict. Now, 10 to 15 hours after birth, permanent closure. And then 10 to 21 days after, now the birth, unless there is an oxygen remain lows. Problem with persistence of fetal circulation. The patent open ductus arteriosus and patent bukas pa rin, hindi nawala yung foramen ovale. Okay? It's characterized at the 8% of congenital heart defects. Yun ang magiging outcome, as I mentioned to you. Kasi ginamit lang siya during the placental circulation with your fetus, both causing a mixing of oxygenated rich and oxygenated poor blood, causing a tissue not fully oxygenated, and this one could cause cyanosis kapag nag-persist at hindi nag-close. Surgical correction, of course, and many defects could undertake until the child is until school age. Kasi meron pa rin yung murmur or yung parang maingay na sound kasi nga nag-start pa lang mag-close yung mga foramen ovale natin and the ductus arteriosus. Hepatic system, liver function 4 to 6 weeks, full liver function after delivery. So, remember, nagkakaroon man siya ng function pero still the mother, okay, the placental mother is the one giving all the nutrients and the waste product. Musculoskeletal system, bones and the muscles developed by 4th week. Fontanelles, ano ba yung fontanelles? Yung bunbunan, areas less than 2 bones meet. 7 to 8 weeks arms and legs movement. The gastrointestinal forms during the 4th week. Okay, so this is the middle portion of the intestine out of the cord during the 5th week, returns during the 10th week. If it is not, there could be the omphalocele present at birth. So ito yung mga congenital anomalies. Meconium, a dark green to black tarry waste accumulated in fetal intestine near the term. So pag nagkaroon ng meconium staining, titawag, it means stress yung ating fetus, and that is not a good prognosis. Pag nag-fetal stress, the fetus could be compromised. Renal system, kidney form in the 5th week and begin to function 4 weeks later, voiding into amniotic fluid. Low volume can show renal dysfunction. Renal malformation can be diagnosed in the utero. The GFR is low at birth, or the glomerular filtration rate. Neurological, formed from the ectoderm during the 3rd week, respiratory effort, the swallowing natin, 12 weeks, okay? Suckling, 29 weeks, fetal movement, 16 to 20 weeks could be felt by the mother. Endocrine system, thyroid gland first to develop, insulin produced at the 20 weeks, integumentary system, 7th week, 2 layers of cell, vernix caseosa, okay, protective skin, lanugo, fine hair. Ito sasabi ko sa inyo maliliit, buong parang unggoy kasi punong-puno, but those are the fine downy hair, lanugo. 10th weeks, there's a fingernails and toes. Sinamarize na to, we have the immune system. Pag sinabing passive immunity, it coming from the mother, active immunity from the fetus. Multi-fetal pregnancy, there could be chances that dalawa, I told you, instead na isa lang ang na-fertilize, there could be two, and those are the main natin sa discussion natin to second semester. Assess for fetal growth and development, health history, mother, nutrition, personal habits, the accident, and intimate partner abuse. These are important for us to identify, okay? Lalo na sa mother at the time during the pregnancy, lalo na yung first 3 months or the first trimester. The fetal growth estimation, there should be fetal movement at least 10 times a day. We are using the Sandowski method and Cardiff method. Yung Sandowski method, a woman counts fetal movement 3 times a day after the meal. It is a fixed period. The fetal movement counting may be done over a period of an hour, daily, and rapidly changing into anticipated 6 hours. Kailangan kasi para malaman doon na yung nagkakaroon ng incident na hindi gumagalaw yung fetus ko, yung baby ko, and then we would see na stillbirth pala. The cardiac, a way to assess an intrauterine well-being, is which expected women records fetal movement during her usual activity. There should be at least 10 movement within 12-hour period. If fewer than the movement, 10 movements are perceived, then we refer to the physician or to the OB-GYN. So the fetal heart rate, normal 120 to 160 beats per minute. Never forget that. Rhythm sleep testing of fetal heart tone for 20 minutes. Mother dapat nakaposition ang left recumbent position just to see the normal heart rate. Non-stress test, the fetal movement, there would be two acceleration of fetal heart rate for 15 seconds, and that is reactive, meaning buhay yung ating fetus. The fibroacoustic stimulation, contraction stress test, ultrasonography, maternal serum alpha fetoprotein. Maraming beses madidiscuss to. These are all the tests, and then I will be launching the laboratory test. Okay? May na-mention na ako in particular sa ano to, implantation, right? Yung mga test natin doon. Then percutaneous umbilical cord sampling, the biophysical profile, the fetal activity, breathing movement, fetal body movement, fetal heart tone, amniotic fluid. The highest score is 10 and the most accurate is the biophysical profile. During pregnancy yan, check kumbaga diagnostic test, the fetoscopy, the chorionic villus sampling, and the amnioscopy performed to assess the meconium staining. Kasi kung na stress, I'll be uploading another one for the diagnostic test para mas comprehensive. That is more on the fetal heart rate, the most important for us to see during the time of the labor lalo na. Ito, fetal heart rate, check natin kapag nasa Leopold's maneuver natin. Okay? Kasama yon sa assessment ng monthly. Lalo na, maririnig mo lang yan sa second trimester onwards. Pero sa first trimester, you cannot identify mostly of the fetal heart rate. What are the teratogens? As mentioned, it is environmental exposure that adversely affect the developing fetus. Maternal condition, there could be alcoholism, diabetes, okay, phenylketonuria, smoking, infectious agent, like i-discuss ko to, individual, okay, pagdating sa second semester, or during sa pregnancy, mamimension ko to, the toxoplasmosis from the litter or dumi ng pusa, rubella, syphilis, herpes simplex, cytomegalovirus, varicella, and encephalitis, mechanical problem, amniotic band constriction, umbilical cord constraint, and chemical drugs, radiation, hyperthermia, or direct trauma are all anything that could harm the fetus. That is your teratogens. So, I hope you understood. Sa fetal circulation, na importante doon yung parts at yung shunting. Okay? Kung sino yung palabas na oxygenated blood, yung ductus arteriosus, yung foramen ovale. I know it's hard to absorb everything. I hope you would read your books at the same time. This is the fetal circulation, the fetal development, and then we'll be uploading the pregnancy and a lot of videos for you to understand. Thank you.